Hi. So today we're going to be doing I'm going to be doing my injection video. So I'm going to go ahead and get started, and I'm going to want to verify my physician order to my MAR. So I have Mr. Jack Buzzard 62019XX, 62019XX, no known allergies, no known allergies. This is for today. For my 7 o'clock meds, I have ceftriaxone 1 gram IMQ every 6 hours for infection, reconstitute in 2.5 ml of sterile water. Ceftriaxone 1 gram IMQ 6 hours for infection, reconstitute in 2.5 ml of sterile water. At 7 o'clock, I have my 7 o'clock PPD 0.1 ml ID today, read in 48 to 72 hours. 7 o'clock PPD 0.1 ml ID today, read in 48 to 72 hours. I have my 7 o'clock MPH insulin 12 units sub-Q before breakfast. I have my MPH insulin 12 units sub-Q before breakfast, 7 o'clock. I also have a 7 o'clock sliding scale regular insulin sub-Q AC and HC. And 7 o'clock sliding scale regular insulin sub-Q AC and AC, and then I have my sliding scale. Alright, so we're going to go ahead and pull out my meds. So I'm going to need ceftriaxone. I'm going to need my sterile water, my tuberculin, and my MPH regular, and I'm going to want to look at all of my vials here and make sure that they're not expired, and they're not. Everything looks good. Not expired, not expired. So I'm going to go back to my order, and I'm going to verify and do any type of dosage that I need to do. So I need ceftriaxone 1 gram for infection, and my vial is ceftriaxone, and there is 1 gram in here, so I'm gonna leave that alone. I'm gonna use all of it. I'm gonna add my 2.5 ml to that and pull out my 2.5 with my gram in there, so that's good. I have my TB PPD here. There's about 1 ml in here, so all I need to do is draw up my 0.1 ml. Then I have my MPH insulin, and there's about 100 units in here, and all I need is 12 of that. And then I'm going to go to my labs, and I'm going to verify and look at my patient's labs to make sure I'm getting the right regular insulin. And his glucose was 389. So I'm going to go back to my sliding scale, and I'm going to look for 389, and 351 to 400 is 12 units. So I'm going to give my patient 12 units of the regular insulin as well. So in all, I'm going to give 24 units, 12 of MPH, 12 of regular. So I have everything I need, and everything is matching to my MR, or to my MAR. So I'm going to grab my supplies now, and I need my alcohol pads for my vials, and I need my 3 ml syringe and 2 needles for my antibiotic, one to draw and one to use on the patient. I need my TB needle and my insulin needle. So I'm going to want to begin with the antibiotic here, so I can go ahead and reconstitute that. Let me make sure I'm filming everything. Wow, you can't see anything. Okay. So I'm going to start with my antibiotic here. So for some reason in my kit, I only got one of these. And so we're going to pretend that this is just powder. And so I'm going to begin, and I'm going to draw I'm going to prepare. So you heard, so this is my 1 gram that I'm not going to have to do any dosage on because there's already 1 gram in here. So I'm just going to add my sterile water to that, and I'm going to give the full 2.5 ml of my gram according to my order there. So I'm going to go ahead and put my needle, put my needle on my syringe here, and I'm going to clean off my vials with some alcohol. So I'm going to pop my vials off. I'm going to clean and clean. And I'm going ahead and I'm preparing this in my patient's room so that I don't have to label my needles and my syringes, But I would label them if I was like in the med room or just anywhere away from my patient's room. So I'm going to go ahead and draw my 2.5 of my sterile water. So I'm going to take this off, and I'm going to want to draw 2.5 air of that syringe. And I'm going to stick it in my sterile water, push my air down, and pull back my 2.5 of sterile water. And that's my 2.5. I don't know if you can see it. I'm gonna move this. Let me put this in here. I'm gonna put that in there, and I'm gonna push my 2.5 of reconstitute in there. While I'm doing this, if it was powder, I would swirl it around and make sure that I'm getting water on the walls just to get everything off. I'm gonna go ahead and pull that out, and I'm going to recap my needle here. And I'm gonna also move my camera so that you can see better. I don't know what to do. Yes, finally. Oh my gosh, and I'm so sorry about that. Hopefully I don't get anything. Okay, so I've drawn up my, I have poured my 2.5 in here, and I'm going to just do this here. I don't want to shake it off or anything. I want to just swirl it around, and I want to just up and down, really gentle, to make sure I get all my powder in liquid form. So I'm gonna go there. And then with my same needle that I did that I drew my sterile water up in, I'm gonna go ahead and draw it into my syringe. So again, I'm going to get 2.5 of air, and I'm gonna go in here, inject my air, and then pull out my med. And I would be using a 23 gauge and a 1-inch long needle, but I didn't have any of those in my kit, so right now I'm using like a 25 gauge. Okay. So that's that, and that's my 2.5 of my Ceftriaxone, and I'm going to just put the safety on because I'm not going to use that needle on my patient, and I'm going to throw this away in the sharps container, and I'm going to open my new needle that I will be using on Mr. Buzzard, and I'm going to just close it off here, and it's ready to give. And again, like I mentioned, if I wasn't in the room, then I would label this. All right, so now I have my TB needle, my PPD, and I just need 1 ml of that one, 0.1 ml. So I'm going to clean my vial. And I'm going to inject it and stick my patient with the same needle because it's just one. So I'm going to pull it off. I'm going to draw back my 0.1 of air. I'm going to stick it in here very carefully. Put the air and then draw back my 0.1 of that. Right. And there's my 0.1. And I'm not going to want to safety it because, again, I'm going to use the same needle. So I'm going to come here and very carefully, very carefully close it against a hard surface. Okay. So my TB is ready. I have 0.1 in there. Now we're going to move on to my insulin. And I'm going to clean my vials, and when I checked my when I did my dosage step, I saw his insulin his glucose was 389, and that I was going to need 12 units of regular insulin. So in my med chart it says 12 units of MPH, so I'm going to draw back 12 units of air. And these needles are very fragile, so I'm going to go to my MPH, push in 12 units of air and draw back. I'm going to grab 12 units of air for my regular. And I'm also going to put that in gently, push in, and immediately draw my 12 units of regular insulin. And I'm going to verify my 12 units with another nurse. Then I'm going to come back to my MPH and grab another 12 units, and go down to 24. That's my 24. And I'm going to show the camera. I don't know if and I'm going to show my other nurse, and they agree with me. I drew that up good and correct. And I'm going to put my needle there. All right. And so I am going to leave that there, and I'm going to check again and make sure that I got the right dosage. So I drew my 2.5 ml of reconstitute sterile water into my ceftriaxone, and I pulled my 2.5, so that's ready, of my 1 gram. And then I have 0.1 of my PPD, and I have my 24 of my insulin. Okay, and all of that is correct in my orders. So I want to give my insulin within 5 minutes, because after that then it wouldn't be any good. So I've came into my patient's area or room, and I have explained to Mr. Buzzard that I have to give him a 7 o'clock meds, and that I will be poking him 3 different ways. And I'm gonna verify. Mr. Buzzard, what's your full name? Jack Buzzard. And then what's your date of birth? 6/20/19XX. And are you allergic to anything? Any meds that you have allergies to? And he says no allergies, so that's good. I'm good to go. And I'm gonna start from my least painful to my most painful. So I'm gonna start with my PPD first, and I'm gonna want to do it on Mr. Buzzard's forearm area. So in my order, I am giving you, Mr. Buzzard, 0.1 ml in your intradermal here, your forearm, and I will be reading it in 48 to 72 hours. Okay, so I'm gonna do it in his forearm. and I'm gonna want to pull back. I've cleaned his forearm, and I'm gonna want to pull back, and I'm gonna take this off, pull back, and I'm gonna want to go in a 10 to 15 degree angle, perpendicular to his parallel to his skin there, and it's gonna be 10 to 15 angle. And I gave it and I released, and I'm going to put my safety on and throw that in the sharps. My next one is going to be my Sub-Q, my antibiotic. And this one is going to go, sorry, not my, I'm gonna give my insulin second, sorry, not my Sub-Q, not my antibiotic. I'm gonna go Sub-Q with my insulin. And so I'm going to want to do it in his belly area, and I'm gonna look at his skin and make sure that there's no type of breakdown or redness, or I want his skin, the skin that I'm gonna go on, to be good skin. And I'm gonna go on the opposite side that he went on prior. So I'll ask Mr. Buzzard, Mr. Buzzard, I'm gonna go on your left, okay? Because the last time we gave it to you on the right. So I'm gonna do the left now. So I'm gonna want to go a few inches away from his umbilicus, and I am able to pinch his skin. So I would be pinching, and I would do a dart like motion and just give straight in and out. If he was thin, then I would go at an about 45 angle, and I would give it to him at a 45 degree angle, and I would throw this away in my sharps container because I no longer need it. And then I would throw that away as soon as I used it into the sharps container and be done with that one. And I want to make sure that when I give him his insulin, that he does have his tray around and near him, and that he's able to have some food with it. And I'm gonna move on to my antibiotic. So I'm gonna look at my order again, and I'm gonna see that my antibiotic is 2.5 ml. I'm giving my full gram of the powder in here, and so I'm gonna want to go to his vastus lateralis, or his vetrogluteal area, and I'm gonna go at a 90 degree area, or 90 degree angle, and I'm gonna give slowly. Okay, so I'm gonna just take this off, and I'm gonna inject slowly, and then I'm gonna just put my safety on, and I'm gonna give him that med. And Mr. Buzzard, so this antibiotic that I gave you is going to maybe make your tummy a little uncomfortable. If it does, please let me know, okay? And I'm gonna leave your call light in reach so that you can call me, and we can get that taken care of. So my antibiotic, before I gave it, I should have looked in my drug book and seen that, just verified that this was a good dosage for Mr. Buzzard. And so I'm gonna go and find it, and here it is. And it says that for an adult it should be 600 mg every 12 hours, and my doctor ordered 1 gram every 6 hours. So I would want to verify that with him and just get some clarity that that 1 gram every 6 hours for that antibiotic was correct. And so I would do that. And so I have given Mr. Buzzard the call light, and I want to make sure that he's not having any type of dizziness, any type of nausea, vomiting, or anything like that that will affect him, that antibiotic causes. So next we're going to move on to my ampule, and I'm just going to clean it and show you how I would open it. So I would clean it, and then I would place it in to this little baggie here, and I would hold it away from me and away from the patient, and I would just pop it off. And as you can see, it's opened, and I would grab my meds with a syringe and a filter needle. I would insert my filter needle and turn right around and pull it out like that. And that's it. Thank you very much. And I would just make sure that Mr. Buzzard was comfortable and okay before I walked off. Thank you.